So hi, my name's Jillian Seaton. I'm going to be the student nurse today, and I already performed hand hygiene. Alright, so I'm going to go come in. Can you please give me your name and date of birth?
Rachel Seaton, October 28th, 1975.
I'm going to go ahead and check the MAR and make sure that it matches. Check your patient identifier. So if she has an ID band, I'm going to scan it to make sure it matches so I have the right patient. Then I'm going to ask permission. Am I allowed to do a head-to-toe assessment on you?
Yes.
Okay, and I'm going to go ahead and get started. So first off, I'm just going to make sure it's okay that I touch you. Is it okay if I feel the top of your head? If you feel any discomfort or pain, just let me know, okay?
Okay.
So I'm just going to feel around to make sure there's no bumps or anything abnormal. While I'm here, I'm going to check behind the ears for skin breakdown in case you had on a nasal cannula. I'm going to check the ears. Do you have any problems with your hearing?
No.
You don't have any ringing, nothing like that?
No.
Do you wear a hearing aid?
No.
Okay, perfect. So now I'm going to move on to the eyes and the face and a neuro exam. So I'm going to go ahead and ask you to raise your eyebrows for me. Okay. I'm going to have a pen light, theoretically. I'm going to shine it in her eyes to check for pupillary response. I'm going to check for coloration of the sclera, any signs of jaundice. Make sure she doesn't have any, if she wears contacts or glasses, if she had LASIK, anything that would affect any abnormal eyes. Does she see any type of circles? That way I can rule out any type of medication that might be giving her some type of toxicity, like if she had digoxin toxicity. So just go ahead and stay straight ahead. Okay. She has good pupillary response. Go ahead and follow my pen without moving your head, your eyes. Good, okay. I'm gonna turn you towards me. Okay, just look straight. I'm gonna check to make sure it's white. She has no yellowing or anything abnormal in her eye. And do you wear contacts?
Yes.
Okay. Now I'm gonna go check around the nose area to look for skin breakdown if she had a nasal cannula. If she did have a nasal cannula, I would want to make sure there's petroleum jelly or something protecting her skin so she doesn't have skin breakdown and that causes redness and uncomfortability. Okay, you're good. You're all good. If she was at any chance of developing Chevexine or had any type of potassium electrolyte imbalance, I'd make sure she doesn't have any twitching in her face by touching her cheek. Go ahead and smile. Okay, now I'm going to go ahead and take my pen light and inspect the mucous membranes, look for moistness, coloration, anything abnormal. So go ahead and open up. Say ah. Okay, you're good. Now I'm going to work my way down the rest of the body. I'm going to start by just checking her carotid pulses. Make sure they're nice, strong, and bounding, that there's no weakness or slight palpitations. Okay, now go ahead. I would check her range of motion at this point, which was told by instructors wasn't necessary to do on film. Go ahead and may I see your arm? Alright, I'm going to check her brachial pulse and her radial pulse at this time. Or when I go to do her cardiac, I could go ahead and check her apical pulse and count for 30 seconds. This is assuming that I already came in and got all my vital signs earlier. I would check for skin breakdown, elasticity of the skin, turgor, moistness by pinching the collarbone. I would inspect her hands to make sure there wasn't anything abnormal. I'd check her capillary refill. Do you have any pain in your joints or in your fingers? No? Okay. Now if it's okay, I'm going to go ahead and listen to your heart and lungs. Okay. So I'm going to check her valves, her pulmonary aortic valve, her mitral valve, and her tricuspid valve right now. And this last section is going to be at the point of maximal impulse, where the heart is closest to the top of the sternum. Okay, and now I'm going to go ahead and flip it and listen for murmurs or any abnormalities. Listening for murmur or gallops. Okay, I'm going to take that same side and check her carotid to make sure there's no bruise, which I don't hear any. And obviously she doesn't have a trach or anything like that. And I'm going to go ahead and listen to your lungs now. Take deep, even breaths. You're listening for crackles, bronchi, wheezing, anything abnormal that could lead to evidence of a respiratory disorder or fluid in the lungs. On the right side, you're going to check the upper, middle, and lower lobe, and on the left side, you're just going to check the upper and lower. Nothing abnormal. You lean forward for me, take nice deep breaths. You listen to her lung sounds all the way down the base of her back. At this time, you'd be checking for any signs of skin breakdown or pressure ulcers. And you would also be able to look at the range of motion during this point in the assessment. If they have trouble sitting up, do you have any pain in your back?
No.
You don't have any discomfort?
No.
If they're wearing a hospital gown, you could check their back on their buttocks area to make sure that there's no skin breakdown or pressure ulcers. This can make it least uncomfortable for the patient. That way you don't have to check it separately. I'm going to go down and I'm going to check your stomach. At this point, I would palpate, see if it was tender, distended, if there's any discoloration, bruising that could lead to bleeding. I'm going to go ahead and listen for any gastro sounds. Okay. I'm going to check all 4 quadrants for hyperactive, normal active, or hypoactive bowel sounds. Make sure there's no distension or uncomfortableness. Okay, and then like I said, I would palpate the abdomen. Do you have any pain in any section of your abdomen?
No.
None?
No.
Okay, I'm going to go ahead and move my way down now. I would usually start in this part of the assessment from the feet up. Since she's sitting in the chair, I'm just going to talk my way through it. First, I would check the toenails to see if they were built up, if they had any type of pressure ulcers on their feet, if they're diabetic, if they had skin breakdown from sitting in a hospital bed, unblanchingness, if their skin was dry, their skin turgor, their capillary refill. I would check the pedal pulses to see if there was a strong bounding pulse. If the pulses are found low on the feet, you know that you don't usually have to check all the way up because that means there's not a circulatory problem. You'd be checking for, you could press on the bottom of the heels if they had really thick toenails to see if the circulation's there, because sometimes it's harder, especially in diabetic patients who have thick nail growth. I'm going to ask you to pump your feet forward and then bring them back to check for range of motion. Good, she's doing it. You can then ask the patient to take their heel and run it down their leg for both ways, just to check their range of motion and their fluidity. You could check their pulses further up, the back of the calf, etc. You want to be examining for any edema, pressing down on the skin, pressure ulcers, discoloration, heat in any of the calves that can indicate a blood clot, which can be very dangerous for the patient. You want to make sure you get on that immediately. You want to make sure that you put on any type of non-slip hospital socks on the patient. That way they're not a falls risk. And if they need circulatory stockings, to put those on them to make sure they have everything working properly. You would check all the way up the thigh to check for skin breakdown or any abnormalities if they have varices. And then you would check the perineal area for any abnormalities, color, if they have any type of skin breakdown, color irregulation, if there's a foul-smelling odor that could lead to an infection. You could also assess for any type of mass, or if there was any signs of genital herpes, you'd want to make sure you made note of that. Do you have any reason to suspect you have an STI?
No.
And you have no underlying burning when you're peeing?
No.
Now, when was the last time you had a bowel movement?
This morning.
This morning? Okay. And was it abnormal? Was it brown? Was it regular in consistency?
Normal. Yes.
And you haven't been having any history of bowel or urinary issues?
No.
No? Are you on any medication, antibiotics for UTIs?
No.
Are you prone to UTIs?
Yes.
Okay, at that point you'd want to make note that they're very likely to contract a UTI. Do you have any pain in your lower abdominal area, any discomfort?
No.
Okay. If they needed any type of cream or treatment at this point, you could apply it just to make sure you're killing 2 birds with 1 stone. Just making sure I have everything. Okay. When you're checking the head, you're also looking for abnormal hair growth or any splotches, signs of alopecia. You would ask them about any underlying health conditions. As long as the patient's okay, you would then offer to get them anything else if they were uncomfortable. Do you need anything else before I go?
No, I'm good, thank you.
Okay, and then you would then go back and document all of your findings to make sure that your daily head-to-toe assessment was done on that patient. It's also important to add that I would have asked the orientation if they knew where they are, the person, place, time, the situation. I would check their gait. I would check their grasp to make sure that there's no neurological deficits that we would have to be concerned about, and to make sure that their Perlo is all correct. And that is everything.